Hello, everybody, and welcome to another edition of Face It and Fix It. I'm Joyanne Haig, and I will be your host for today. You can catch us on CBC TV 8, Q100.7 FM. You can watch us on YouTube or on Facebook by typing in CBC Barbados. If you want to talk to us and we want to hear from you, the number is 228-5563. If you want to send us a WhatsApp message, it's 228-5562. But before I get into my guests and to let you know what is on the program, I want to share some thoughts that's on my mind. I came down to CBC around, let's say, 8:35 this morning, and approximately around 8:20 or 8:30, I was passing Sky Mall and recognized that I'd forgotten my cell phones. I have two cell phones, and I forgot them at home, and I have them plugged in, and I'm saying this because I want Auntie Kathy to be listening, and I know she's watching. They're plugged in on the bed, and I would like you to make sure that you plug them out. And I say that to say this. I could not remember not one cell phone number to call anybody when I got here to CBC, and that's a little scary. I remember my mom's home number, but that's it. So a little bit of advice, and this is what's on my mind. Maybe we should start writing down some of the key cell phone numbers, and you keep them in your car in case your phone goes off or you not, and I cannot remember any numbers in my cell phone to reach out to anyone. So I'm saying that to say this to Auntie Kathy at home, plug out the cell phones, they're on the bed, and I'll come home for them. On another note, I want to offer sincere condolences to the family of Victor Small. Victor, unfortunately, was a diabetic, and he became a double amputee on June 19th, on May 30th, and unfortunately, he transitioned on June 19th. He didn't make it. He's burying today. To you, Victor, and your family, to his family and his friends, my sincere condolences is going out to you right now. So on the show, a packed show, 3 special. We are all COVID tired, and Dr. Joyce Sue is here to assist us with our mental state and give us some advice. I know there's so many of you worrying about your children, exams, work, job loss, you name it. A lot of people are stressed with the curfews, and we need to talk about these things. In addition to that, we are also going to be looking at the aftermath of Elsa, but with the Barbados Council for the Disabled and President Carrie-Ann Eiffel. We often forget persons with disabilities, and we need to put them on the front burner. So we're going to check in with Carrie-Ann to see what challenges they might have had and how we can help for the future with the Barbados Council for the Disabled. And of course, we're also going to speak to the head of the Senior Fire Prevention Officer, Natasha Ford. Natasha is going to be here to discuss house fires and prevention, and which brings me back to the cell phone that I left plugged in on the bed. That is a no-no. I was rushing this morning, but we should not plug in our cell phones on the bed. We should put them on the ground and somewhere where it can't catch a fire, like a tile, etc. But I'm sure we will ask Natasha about those important do's and don'ts and when it comes to fire prevention. So when we come back, we will speak to her. And just remember, call us 228-5563, send us a WhatsApp message 228-5562, or join us on Facebook and type in your comments, CBC Barbados. We'll be back after the break. Welcome back. Welcome back, and we are here with Dr. Joy Sue talking about mental health in a COVID environment. We hear about vaccines and all types of things in order to help minimize the spread of COVID and wearing masks and sanitizing. All of this has taken a toll on all Barbadians and people around the world. And I think that mental health is the key component, aside from the physical health, that we need to make sure that we have a strong immune system. Our mental health is actually very, very important, probably even more important than the physical aspect of your body, because the mind, in my opinion, controls the body. But I will let Dr. Joy Sue answer those questions for me. Good morning, Dr. Joy Sue.
Good morning.
You're there?
Yes, good morning. Thanks for having on.
Good morning, and how are you doing?
I'm okay this morning. Thanks for asking.
Thank you. Well, even though in your practice you might still be overwhelmed somewhat with the enormity of the problems that we see on the ground, but I want to ask you about let's start with the children first, and then we'll deal with the grown-ups. The types of things that are impacting children right now in this pandemic. What are you seeing, and then what is happening right now for the last year and a half?
Well, we did an audit of presentations, persons who were presenting to the hospital, which is our unit. So that includes persons who came in person as well as calls. And what we found is the most frequent presentations for persons where the presenting complaint included something concerned with suicide, so suicidal ideation or suicidal threat. The most frequent category was the 12 to 24-year-olds. So quite a number of children are presenting to the unit now with suicidal ideation, which was something that we hadn't seen in previous years. So it is showing that a lot of children are now under stress that they're accustomed to. A lot of them are also presenting with depression or anxiety problems. So these are some of the things that we have to be looking out for before our children know.
So are you seeing more males and females amongst the children?
No, we're still seeing the usual trend, which is more females, because those males as well, and I think if we check it, it might probably be more males than we were accustomed to seeing before, but it's still the females who are more frequently presenting. And I think that's a cultural problem, something that I have been trying to talk about with previous public speaking engagements, and that is about males and how we, in our culture, we don't encourage males to speak of feelings, or males don't have as much support to speak about feelings. Males are encouraged to speak out, they speak to their female friends about the problems that they're having. They're more likely to go to their parents and talk it, but males feel that they have to show a strong front. So I am not supposed to be sad, I'm not supposed to get down, I'm supposed to be strong for everybody else. And so they try to keep it inside, and sometimes that is to their detriment, meaning that things worsen because they don't get the help that they need.
But yet you said you see it more in females than males. Is it that the suicide rate is higher in males? I had this argument only yesterday, and I said it's higher in males than females.
For persons
Generally
who complete suicide, for persons who complete suicide, meaning persons who were killed, it is higher in males. However, tend to attempt more frequently, so among others, they are more frequent. And there may be a number of reasons for that. Males tend to choose more means, so things like hanging or using a pesticide or using a gun. Those are the means that males tend to use, which there's a higher chance of that ending in death. Whereas females might more tend to go for something like pills, something that's not as disfiguring because of our self-concept and our importance on appearances. So we don't want to have to go through something that will necessarily be that painful. So we go for something like pills where there's more of an opportunity that the person can be saved.
Loss, children can't go to school. As a parent, what signs should I be looking for in my girl? Well, I have two girls, but what signs should we be looking for in our children in this particular environment? Are there any signs that we can?
You're looking for things like changes in their mood. So for a lot of kids, they might not come to you and say they're feeling sad or they're feeling depressed or they're feeling down, but what you might notice is irritability. So a lot of kids might become very irritable. They might snap at you for little or no reason. And you may see that as the child is suddenly being rude, but it may not be that a manifestation of the fact that a child is now very stressed out. You may find that the child may become increasingly nervous as well, or they may be reluctant to do things like home. They may become more withdrawn and avoid interacting with others in the family or their friends, so they may want to stay inside by themselves a lot. It may get to extremes sometimes where kids no longer care into their hygiene needs. So you may find also when they're talking, they're expressing a lot of negative thoughts, or they're having difficulty at night with sleeping. And it may be that they're having that difficulty at night with sleeping because they're having a whole lot of thoughts and they can't get their mind to settle, calm down. There are changes with their appetite, so the child may not be eating as well as they used to eat, not eating as much as they used to eat. There may be changes with their energy levels, tired all the time, doesn't want to participate in the activities that he used to participate in. Instead of you just have to be aware too, some children might eat more too, so it may not just be the weight loss due to lack of eating, but some people have weight gain as well. And well, I have to say, I don't like to think about the thought, but there may be some children who may engage in substance use, smoking marijuana, or who may be finding alcohol to use. And those are all some of the warnings that things going well with those kids.
So tell me this, as a parent, because I mean that's a lot, and it's a lot for children to take on, but it's a lot for parents to take on too. So if I have to go to work and I'm stressed out with all of these protocols, and I have to then worry about the children, and I have to look for all these signs, but then I got to look after myself too. It's a lot to swallow. So as a parent now, what can we do to keep our sanity? So that we can help our children, because if we lose our minds in this whole process, which I know some parents are, for sure, when I say losing their minds, there's they can't go to school and the children are at home and they can't work, and then somebody loses a job. How can we cope then to be able to manage our children? Isn't it like putting on the oxygen mask first and then maybe giving it to the kids? Shouldn't we try to look after ourselves and our mental health first and then maybe the children?
I completely agree. In fact, I use that analogy myself. I have to make sure that you are in a good place first so that you can adequately take care of someone else. So for parents, they have to make sure that they're placing enough time on their own self-care as well. Sometimes you can incorporate the children into those activities as well. But we are getting into a where because of COVID, a lot of people are overworking. There's many other set workers, the supermarket workers, the persons in the hotels, and so on. Maybe overworked. I heard a conversation a couple of days ago with someone saying because they were out of work for so long, they were home because the hotels and so on were for so long, that now the managers are saying that they're not giving them any vacation time. So you get into a point where we're overworked, but we have to make sure that we put strategies in place to ensure that we are getting time for relaxation. Whether that is when you go home, you're going to take time and you're going to read. My favorite thing are some person to put in exercise if you can every day, if not at least 3 days a week, some sort of aerobic exercise. It could be something as simple as therapy. So if you have some time to engage in that, or it could be music. And one thing that has been really shown to help is meditation. And a lot of people, I hope a lot of people are trying this method now. Meditation is something that helps us to relax and calm the mind. Right now, a lot of persons are of chronic stress. The COVID-19 pandemic, how long it will last, and this sense of uncertainty. So curfews being imposed and then curfews being removed, and then numbers go back up, curfew imposed again. You have this sense of uncertainty of you don't know what to expect, and that breeds a lot of anxiety. What I find with that is that when you have that chronic stress state, it's danger. So, your heart rate goes up, your breathing increases. Imagine having those type of things going on in your body on a chronic state, on a long-term state, that kind of awareness, or heightened awareness in your body. It's going to create problems for you and physically. So meditation helps to relax that state, turn it off, and help your body then to just relax afterwards. And it's good to practice daily meditation if you can.
So,
And there are a number of apps that came out of COVID that help with persons to do that.
because I was asking about the meditation in terms of how to, because I last week Saturday, and my daughter wasn't there, and for me, I just didn't want to do anything at all. I mean, I shut down completely, and I didn't even want meditating this, and you just lie there and just totally relax, where you don't even answer the phone. But what I want to ask you though, is there another impact we're talking about here with the mental stress? Can we not go into the zone of I don't care anymore, I had enough of COVID, I am not adhering to no rules, I'm sick and tired of wearing a mask? So it goes from, okay, 1 minute you're scared, a little angry, anxiety. Can you get to the stage where we're seeing some people who are not following the protocols because they're just fed up?
Well, yes, we have two sets of people here now, or maybe even three sets. So we have a set of people who are so fearful, making them feel quite anxious, because in following the protocols that closely, you may be cutting yourself off from friends and family and that kind of interaction, because you may feel as if you interact with them, you're putting yourself at risk. So you may have cut down a lot of activities that previously gave you pleasure. And then you have the set of people now, because of the duration of time that this has been going on, that people are fed up, they're frustrated, they've reached a breaking point, and they hey, I can't do this anymore, and this send me crazy, quote unquote, and doing whatever they feel like now and ignoring the protocols. A set of people that were never following the protocols in the first place because they believed that COVID was a hoax or something like that. And so we have these three sections of people here, all of whom are going to be at risk for some kind of mental health, poor mental health outcome.
Oh, okay. So basically, with what you're saying is that there's so many different aspects of the impact of COVID. It could go into panic attacks. You could become people who just don't even leave home anymore. I know some people who are shut-ins and not shut-ins because they're physically or mentally challenged. They're just scared. We're seeing all types of mental responses, I would say, to this. I don't want to shift too much from the COVID, but I can't let you leave without talking about the crime situation in Barbados. And I wanted to know about the triggers and if there's some sort of data, crimes in this country, so that we're able to see a trend. Is that something that is practiced worldwide in terms of criminal psychology? I don't want to think too much, but I couldn't let you leave here without asking that, because we do have we have a problem in this country and worldwide, and you would have seen an increase probably because of COVID, job losses, etc. People are frustrated, some people are just broke, and some people are just career criminals. But I wanted to ask you about, is there some sort of data that we collect to give us an insight as to the triggers of some of the crimes that we're seeing here in Barbados?
Well, to answer that question in short, at present, no, we're not collecting that data. And that's a tricky one, because there are some people out there who are committing crimes and that has no connection to mental health whatsoever. Those persons, or rather I should say, it has no connection to mental illness whatsoever. Illness.
So, okay, what's the difference between... But what's the difference between the two, mental illness and mental health? If you can explain.
When we're talking about mental health, we're really talking about what goes into maintaining your mental health, similar to what goes into maintaining your physical health. Whereas, so when we're talking about mental health, it does not mean we're talking about somebody who's ill. Then it applies to everybody. So it's not just for somebody who has a mental illness. One of the factors that we look at under mental health. And we are saying mentally ill, this person who's no longer able to function in a variety of areas in their life So this illness or their symptoms of mental ill health are to the extent that it is affecting them, say, functioning at work, with their social relationships with family. For instance, if it's a child, it's affecting functioning at school. So there are two different things. So it does not mean that so the opposite of mental health is not necessarily mental. It's a more complex relationship than that.
Okay, but we could have people who commit crimes with who may be mentally ill, and there's some the triggers that may have mental health issues.
Crimes, and by far and large, persons who commit crimes do not necessarily have mental illness. And there may be some persons who are facing what I would call psychosocial stressors, so psychological and social stressors, which in this time might relate to COVID, but they will not be mentally ill.
Okay, we have a WhatsApp
what
right
you
here.
have now is a lot of pressures due to unemployment, for instance. That's a social pressure. A lot of persons are facing unemployment. They can't make ends meet. They can't pay their bills. They're losing their homes. I was discussing the other day, a lot of young fellows, young men in this country, when they get that first job, start to feel that they're happy, one of the first things they like to do is go and buy a car. A lot of young men now they can't make the car payments. The cars are being repossessed, and that's a stressor for them. So that's what we would call a psychosocial stressor. It does not necessarily mean that it will make the person ill, however. There's a continuum along before you get to illness, where hopefully we can do things to prevent it going to getting illness.
Oh, okay. So we have a question here, well, a statement rather, in a sense. The person is saying that they're feeling and a constant headache, that tablets just don't seem to cure. Tell us about anxiety and panic attacks. And if I'm not telling you to diagnose the person, because you would not be able to, obviously. So to speak in general about panic attacks and anxiety.
Well, a panic attack, first things first, is not a diagnosis. It's actually a symptom that's associated with other conditions. And in truth, almost everybody probably would experience one or two panic attacks at some point in their life, depending on what the trigger for you is. So a panic attack is when you get this intense feeling of fear. It's usually a variety of symptoms that come for it. To say that a panic attack usually require about 4 of these symptoms. So it's things like shortness of breath, chest pain, which means your heart is beating fast, or you feel like your heart rate is accelerated. You have sweating, you have trembling or shaking, nauseous, you're having this abdominal discomfort, you feel as if you faint or pass out, or what Bayesians would call bad feels, basically. These hot and cold kind of sensations. You get pins and needles type of feelings in the fingers or the toes. You feel actually like you're going to die. So a lot of people will report that they feel like they're going to die, and they will present to the accident emergency department because they think they're having a heart attack. Either that, or they may feel as if they're going crazy, or they're losing control. They feel like if they're not, like if everything around them is not real. So they have this feeling of being detached from themselves. And so it's a constellation, as I say, it's a whole lot of symptoms that comes that qualify as symptoms of a panic attack, but the panic attack itself is not necessarily a diagnosis.
All right, well, we're going to ask you one or two questions before we wrap up. People normally say that if you see a psychiatrist, people would think that the first thing they tell you that you're crazy, and or a psychologist. And a lot of people don't want other people to know that they've reached out. And I'm hoping that with this show, and I think at some point, even if it's not a psychiatrist, we all need somebody to talk to, because we all go through our rough moments. What can you tell people who are listening to you now, who might be thinking about, I may need to see a psychiatrist? When do you know, first of all? And how can you explain to them what to do with it, to get rid of that myth that if you go and see a psychiatrist, you're going to be mad?
Well, you should be ashamed to have to see a psychiatrist or a psychologist. Again, that is something that is more cultural here in places like the United States. It is more commonplace. It's even something that is encouraged as part of employee assistance program. But we just need to get it in this country where we recognize that this is important, that should address. And for persons who want to know when they need to see a psychiatrist, it really goes back to the things I said before. If you find that you're having symptoms of nervousness or anxiety, know your attitude has gone really negative, or you used to love your job, but now you don't think you're getting to work late all the time, or you're not at all at times. So at the point where it's interfering with the functioning of your day-to-day activities, things that you used to love, that know things that used to be simple for you to do before, then perhaps that is time for you to be seeking help. I would argue that maybe even before you get to that stage, you should be trying to seek some help, even though that may not have to be a psychiatrist or a psychologist. It could be just to speak to a friend or family member, or just like
Okay,
about what is
so
bothering you.
all right, we're going to be back after the break with more questions with Dr. Joy Sue. We'll be back. Welcome back to Face It and Fix It. We are speaking with Dr. Joy Sue on a matter that no one likes to talk about, mental health issues, and in particular in this pandemic. The world as we see it, as we know it, is driven by human beings, not machines. We need human beings to create machines. We need human beings to come up with foods to cook and medication to make. Everything is hinged on human beings and their mental health. So it's surprising to me that we don't spend a lot more time on mental health issues, because if we don't get the mental aspects of our life in the right place, then everything else is going to. And the fact that we have people who want to vaccinate, then we do people who don't want to vaccinate, and then we're seeing in France, for example, the government in France mandating healthcare workers to vaccinate, and then other persons to show a health certificate when entering theaters, restaurants. Now, generally speaking, and not only just in Barbados, if we start to see things like that, how can that impact a person mentally with the separation between the vaxxers and the non-vaxxers?
Well, I think we're starting to see a bit of that now already. There are a group of people who believe that the vaccine should be made mandatory on one end, because they think that the people who are not getting the vaccine place them at greater risk. But then the people who are not getting the vaccine feel that is personal choice and that is infringing on their rights for someone to try to force them to get a vaccine. So we must remember that there's a lot of information out there, or misinformation rather, a lot of conspiracy theories circulating, and with that breeds a whole lot of fear. The fear from the conspiracy theories, and people very fearful to get the vaccine because they think that the vaccine is going to result in something negative for them. And then you have the fear from the virus itself, and those who are angry now at not getting the vaccine because they think it puts them at more risk for the virus. He said this is creating divisions, which again are leading to more mental health issues. You have this big group of people who think their rights are being infringed. They think that they should be allowed to do that. No, they can't do unless they're vaccinated. So there's a big controversy in the States about cruises being fully vaccinated, only fully vaccinated people being allowed, and all as anxiety, because this situation has created a time where there is a level of control that's being exerted by governments now, which we previously probably never experienced before. So it's very much getting into the day-to-day life of people. So even something as that we may see, some of us may see as simple as mask wearing. Some people see that as an infringement on their rights. All this creates anxiety, as I say, because persons like to have that feeling that they're in control of things. And I call it illusion, because the truth is we don't really control much of what happens in our life. A lot of that control is things that happen around us that we don't have control over. But having that feeling of having this internal control, that helps to create a stable mental picture, helps maintain mental health. And taking that away, it stabilizes mental health for a lot of people.
My makeup artist, or should I say that of CBC, Joanne Jones, we were discussing COVID this morning, how it's a lonely disease. And when we say lonely, many persons died without holding the hand of a loved one, because once you're diagnosed with COVID, worldwide, you weren't allowed to say goodbye in person. A lot of people had to say goodbye via WhatsApp, video, etc. And it's a really lonely disease. What would you say to persons now who, considering the vaccine, the life versus death, and having that type of information that it is a lonely disease, and it is, you die alone. Others on, and family members who couldn't get that closure but still refuse to vaccinate. You see someone that you love going, there's no closure for you in a sense because you didn't get to say goodbye, but you still don't want to vaccinate. I mean, mentally, how do you cope with something like that? Especially if you, for example, there are cases where people caught COVID and they gave a loved one and that loved one passed. Is that something that a person should have to go to therapy for because you end up feeling guilty for the rest of your life? I know one or two stories like that where people actually feel terrible, but they still want to get vaccinated.
Yes, I think that persons who have had a family or friend or loved one who died from COVID, especially, or who had COVID, especially if they were in a position of having passed on the COVID to that person, I think those persons are at risk for developing a negative mental health outcome later down the road. That would be something that would be very hard to get through. And so I think counseling would be advised to these persons, and I've been trying to address that issue somewhat. What would I say to them? The theories they're thinking of. The mind said it to me recently. We don't know the effects of this vaccine 10 years or 20 years down the line. I said 10 years or 20 years down the line, and in my common vernacular, I said, you got 10 years or 20 years put down? I know what the virus is doing here now. I can't clearly. So I would rather it. But to me, it makes more sense to take the vaccine and avoid the consequences that we're facing now. But as I said, you can't really get everybody to buy into that. And forcing some people to do it, forcing people to get the vaccine, I don't think that that is the immediate answer either. You would see that in some places for healthcare workers where they made it mandatory, some people were fired. I think if we made it mandatory here, for some sectors of workers, people might actually not get fired, but people might quit. We can't afford to lose some of this workforce right now. So we have to pay to encourage people to take vaccine through better education. And that's, I think, is at the bottom of it. We have to allay people's fears.
A question here from WhatsApp. What is your advice for someone who lost both parents to COVID, one last year and one this year?
My advice to the person, well, it was one last year and one this year. I think that would be a person that would benefit from some counseling, be a psychologist or a psychiatrist. As I said, just talk to, and there are a lot of counseling resources available out there. Sometimes there's a counselor or a grief counselor in the church or in other areas, social workers and so on who are trained in grief counseling as well. So I would advise that person to seek some form of counseling to deal with those issues, because I know that it's very hard, and then it leaves a lasting impact on that person in terms of the fear that comes with it as well. So there's fear and guilt that comes as a normal part of this process too when you lose.
Families where you may have the mother vaccinated, the father not. They live together in the same house. They can choose, obviously, not to vaccinate or not. And then you have maybe your son living there, and he chooses not to vaccinate, and then the mother wants to put out the father or even the son because they don't want to vaccinate. I mean, we're in situations where there's some conflict going on in some families where some want to vaccinate and some don't. And people are actually put out of the home because of their refusal to vaccinate, especially when they're young, they want to party. But we will respond to that shortly. There's a WhatsApper here saying, I find now the children are at home, and I am at home also currently unemployed due to the pandemic. The slightest thing they do bothers me, to the fact where I am shouting at them all the time. Something I never did before. Just want this pandemic gone. Is a person on WhatsApp. Your response?
I think that is understandable. As if she's employed, which I know don't want to be either. The kids are home. So remember I said one of those signs is irritability, and that's exactly what she's describing. What I would advise for her is to find, as I said, something that helps to make her feel calm. So as I said, whether listening to music or reading a book, I always advise getting some form of exercise in your schedule or routine. So form a routine that works for you, that might include your kids.
And so
you're getting recharged.
So back to what I was saying just before that question. Families, son does not want to take a vaccine. He's in his 20s. He's partying. He's laming. He's coming home to his parents, and they're saying, "Look, you need to ask your children to leave." Adult children, of course, if they don't practice better behaviors in terms of this COVID. Is this something you've seen? Because I certainly know of two situations that has happened.
I haven't seen it myself, but I've heard persons considering it. So I've not seen it go to that extent, but people have been considering it because it's a valid concern. They're trying to do all the right things, but you have someone who's in your household who, when they come home to the household, they're not going to wear a mask. And that person wants to be out partying, possibly also not wearing a mask. Start simple as just laying on the block, not wearing a mask for a group of people. That person is putting you at risk, is not considerate to the other persons living in the household. And what we have here in this society is that the younger people, they think they're invincible to COVID. Because we had a lot of things going out before, a lot of education going out before saying that it was more persons who had comorbidities like diabetes or high blood pressure who were more at risk than the elderly. Young people got this impression that they cannot get ill from COVID, and that is not true. We have been receiving all the reports now of younger people also suffering severe complications from COVID. So they need to get back of COVID can't touch me and realize that they're placing the other person in the household at risk. And to me, if that person feels sufficiently at risk, it's within their rights to do just that. If it's an adult family member, there's no obligation to have that person in your a little education. Talk, sit down, really talk with the person, present your point of view before you make any rash decision. There have been persons who started off saying, I do not want the vaccine. And as time went along and with education, they changed their minds. So sometimes it just takes some patience. That person who's saying no today might be saying yes in a week or 2 weeks' time based on what's happening. You just have to show them, as I say, the reasons, present the reasons why this is a good choice.
But if you insist on the bad behavior and irresponsible behavior as an adult, bringing it back into a home, then what you're saying is that the homeowner, the people in charge of the house, whether it's your mother, grandmother, or they have a right to protect themselves.
Yes, that's well within their rights.
It's their rights.
This person is an adult. I hate to say where a lot of adult children live at home, but where does the responsibility end for parents? You're an adult. You have some responsibility for yourself, and you don't have the right to place somebody else at risk.
Okay, we have one more WhatsApp, and then we're going to have to wrap up. I think we had one more WhatsApp pertaining directly to you. It was up earlier. I'm not seeing it, no. But if we do get it back, we will. All right, it's not back. But I want to thank you so much for joining us. They were just saying, oh, the doctor is so right. Take the vaccine. Life is a risk in general. So this was just, it wasn't a question. It was just someone weighing in to say that you were correct. But the reason I take this seriously, because for me, mental health, I mean, I spoke to psychiatrists when the first lockdown happened. Just lost Granny. She died dealing with a daughter with a disability, having to lock down, do all of these different things. And I started to feel overwhelmed. And most people that know me would think that, you know, you're there for everybody. It's always the people who are there for everybody need the most help sometimes, because we get overwhelmed with our own problems. We don't tell anybody else about our problems, but we try to take on everybody else's. So I say that to say this: there's no shame in saying that you need help. There's no shame in saying that even if it's not a psychiatrist, because people are thinking maybe money. Is there some sort of free way of persons who might not be able to afford the private aspect of this? Is there a free clinic, the hospital?
Well, yes. Every polyclinic, where I work, I'm a community psychiatrist, so I work in the polyclinic system. I have 2 other colleagues along with myself who work in the polyclinic system. So all the polyclinics are covered by a psychiatrist. All you need to do to see us is to get a referral from a general practitioner, whether it's a general practitioner within the polyclinic itself or that service is completely free. Of course, there's the hospitals as well. We have Queen Elizabeth Hospital. They have a psychiatric service. You have the psychiatric hospital where I employ, which has their assessment unit, which is open 2 hours for emergencies as well.
All right. Well,
so there are 3 ways. The Student Support Services Unit. So I think almost every primary school should have a counselor assigned at this point. I know that they hired extra staff recently to deal with, to manage the concerns that we've been having as well. So that is an option for the kids as well. All these things.
And I know it's way wrapping up, but I just want you to repeat some of these signs that we have to look for as parents, or even in our friends or spouse. What are some of the general signs that we could look for if we think that someone is heading in a direction of possibly taking their life or doing something to just harm themselves?
Well, the sign that for some to harm themselves, if you think that a person may be at risk for suicide, you'll be looking again changes in mood. If the person is very sad, or even if the person becomes very angry, if the person starts doing reckless things like driving recklessly, if the person starts drinking a whole lot of alcohol because they might be trying to build up the courage to go through with it, if you hear the person talking about death a lot, or the obvious the person's talking about killing themselves, if you strange, that sounds as if they're saying goodbye, or calling you up and they're giving you things that you know are treasured possessions and saying they want you to have this. Those are some of the signs as well. If they're having problems, if they're having problems with their appetite, if you find that the person is doing kind of like a preparatory, what we call preparing for it, So the person's gone bought a rope or something like that, or you see cuts on the person's hand that the person might be preparing to do something to harm themselves. If the person is becoming very withdrawn, so the person is not interacting with you or others anymore, the person is not doing any of the activities that they were accustomed to doing anymore. These are some of the signs that you can look for.
And then there are other people that you didn't 2 years ago, and everybody was shocked. They were like, no way, this person was a life of the party. Who would have thought? So you also get that type of person who takes their life, but you never even saw it coming because they're smiling so much all the time. They're actually the one that you go to. There are those types of people too who hide it, that we never even know.
And that is something that's important to recognize. That happens. A lot of family members struggle with it and they feel guilty. But the truth, some people, they won't give you these nice laid out signs. They're going to mask it or they're going to hide it. And they're going to make that plan in silence because they may be a person, as you say, they're accustomed to being the strong one. They don't want the family to view them as weak, so they're not reaching out for help. And so you don't know that the person was having a problem on it until it's too late. Nobody, if this happens to them, to feel that they have to blame themselves, you're not to blame.
Well, I want to thank you, Dr. Joy Sue. I could talk to you all day because, as I said, this is such an important topic. And if we don't get it right with our mental health, then psychiatrists and psychologists and for people in general who just reach out to other people to listen, I want to thank you for joining us this morning. Thank you.
Thank you so much for having me.
Thank you. We'll be back after the break. Welcome back to Face It and Fix It. Well, some of you know that today in Britain, everything is open in terms of the COVID-19 protocols have been relaxed somewhat, and the Prime Minister of Britain basically said, look, we're going to open this up and we're going to see what happens. Recently, I believe his health secretary caught COVID-19 after being vaccinated twice, so he was fully vaccinated. So his health secretary, Sajid Javid, and the Prime Minister then had refused to self-isolate, not in keeping with the rules. He said that this was part of an experiment of getting testing on a daily basis for those who might have been exposed. And about 3 hours after he said that, because people in England kind of pushed back, he then decided to self-isolate. This is the Boris Johnson, the Prime Minister of United Kingdom. And we know that today, the 19th of July, England has decided that they're going to relax all of their protocols in terms of the eating outdoors. However, I believe transportation is being advised that you should still wear your mask. Similarly, over now in France, you have the President Macron making a speech, and I'll just do a little clip of what he said. He said, and I quote, "I am in favor of the French line right now. I no longer have any intention of sacrificing my daughters, as well as their right to study properly for those who refuse to be vaccinated. This time you stay at home, not us." And that is just a clip from Emmanuel Macron, President of France. In August, as of August, persons who are in the medical field, you are required to be vaccinated according to France. Persons who want to go out to restaurants and cinemas, you need to provide a health certificate of some kind, and I believe that would be proof of your vaccine. A lot of people are asking questions, what would that mean for Martinique? What would that mean for Guadeloupe, who were still more or less ruled by France? Barbados. Can we mandate, or are we mandating in a smart way? Because when you have your parties and you say, well, those of you who are vaccinated can come, those of you who have to, others have to show proof of the vaccine or possibly go through a PCR test. Life is changing, and it's interesting to see the war and the separation between the people who are vaccinated versus those who are not. I pray not, and I hope COVID-19 brings us together, but in some countries it's driving us apart. Our next guest is Carrie-Ann Eiffel. She is the president of the Barbados Council for the Disabled. Good morning, Carrie.
Good morning, Joanne.
Former Commonwealthian up and on.
There is no such thing as a former Commonwealthian, Joanne.
Well, this is true. My fellow Commonwealthian, my apologies.
There you go. That's right.
There you go.
That's
there you
right.
go. How are you doing, hon? You good?
I'm doing good. I'm doing pretty good. And yourself?
Not too bad. Not too bad. I'm holding on like everyone else. We had an interesting discussion about mental health, and we're glad that you were here. And let me publicly apologize for not having you on earlier. The show more or less started the last couple of weeks, and we want to bring the agencies on who are responsible for assisting Barbadians. And I'm hoping that whatever we could do for the council and persons with disabilities through this show, we're going to try to do it. So I know that this is your first, but will not be your last appearance on Face It and Fix It. What feedback did you get from the members of the disabled community during and after the storm?
Personally, I also did nothing. I got a good rest because there wasn't much. I was fortunate enough not to have had any damage to my home or anything. That being said, that's just me. The devastation. Too long we got complacent and thinking, oh, we live so, our island is so close to the equator, nothing will happen here. The hurricanes pass us by. Yes, they do pass us by for the most part, but we still need to be prepared and recognize our own vulnerabilities. And when you add to that the added vulnerability of persons living with disabilities and their families, you can end up in a very difficult and untenable situation. Now, persons with disabilities, yes, we live in the community like other people, and so when we were losing electricity, the Barbados Council for the Disabled, our Harambe house, we were without electricity until Tuesday last week. So we were personally hit very hard in that way. We had to reduce services, staff were back on remote work. We always have that. A lot of our persons live on fixed, very small incomes. So doing incremental repairs to your home and so on isn't something that a lot of us can contemplate on a regular basis. But in a hurry, if you are unable to take care of yourself in that regard, you do end up in a ticklish situation. You couldn't board up your windows, those kinds of things. And then, of course, you have people in society that would say, well, if you can't handle it, then you should live alone. Everybody has the right to live where they choose. But with that comes added responsibilities and challenges. And so I think that a lot of our persons with disabilities had some serious stresses. One of the major areas of concern, though, for me, are persons with disabilities who were left extremely vulnerable without means of communicating with the outside world. In one instance, I know of a person who lives alone, who's totally blind, and she doesn't have the financial wherewithal to own a cell phone. she doesn't have a telephone with her, she would have had to wait until the hurricane passed and somebody came to check. Fortunately for her, her electricity came back on that night. She told me she was terrified because she was there alone and she couldn't get out to reach anybody. One case. There are many others who live with that. And so there's a whole heap of things that this has brought up for us that we need to look at. So I think that was quite a mouthful there for you.
Yeah. So persons living alone with disabilities, with a disability, would you normally have a telephone number or suggest to them to have a contact number of the neighbor, somebody close by in that would check in on that person? Is there a list that you could ask them? Bring in a list. Let's know who your neighbor is. Let's get a telephone number.
Persons to have the buddy system. COVID did definitely to those persons that live in the community that really aren't part of the community, if you know what I mean. Mm-hmm. And we recognize, so I know agencies like the National Disabilities Union, that's the government department, Barnard, which is one of the member agencies of the Barbados Council for the Disabled, the special persons with disabilities in her own capacity. They've all been encouraging persons with disabilities to develop their networks and such. And the Barbados Council for the Disabled, of course, we do our part. But I think we definitely need to work on education. I told somebody the other day in a totally different context, disability is the ability to be spontaneous. And in disaster situations, that is extremely true. You can't until the day before start planning out, run out to the supermarkets. We can't just decide, I'm going to ask Joanne, who lives next door, if she'll check in on me. You can't wait until the day before to do that. If you are limited in your mobility, these are things that are addressed up front. But I also think that service providers, when they are putting their services out there, they also need to take these situations into consideration.
I want to put something out there to what I discovered a couple of weeks ago. I think it was just before the storm. So I was in a particular supermarket and this gentleman was there shopping in a wheelchair. And I was next to him in the vegetable section and I'm taking up, I think it was the mixed herbs and some chives. And he looked at it and he said, "Ma'am, you could look in there, so tell me, if you see anything better looking like this." So he in a wheelchair, the vegetables now go way back. So for you now to search for the, something looking decent, he's limited because he can't reach all the way back. So then when he was finished now, I got into the line and you got to stand 3 feet apart. So we're actually, and he's just looking to see which cashier he could go to. Do you know that I was about 5 people down from the person and the next person in the line, and I could see the next person, which is the first person, because I'm number 5, walk past him, then offer him to, hey, put your things there. So I got out of my lane to stop the next individual to say, "Excuse me, could you give him a little break?" I said that to say this. I'm not sure if the supermarkets offer this, and if they do, I didn't see it at this supermarket. When a person comes in a wheelchair and the things at the top of the shelf, how are they going to reach? Why should they be subjected to pick up the first thing that they can put their hands on and not necessarily the best product in terms like vegetable supermarket? There was nobody there.
Joanne. That's a whole other conversation right there. Because it starts from, don't get me wrong. Let me start. I had a personal trainer. He used to say criticism, praise. So let's start with this portion. There are a lot of agent supermarkets and whatnot who do try and who have improved on their systems. Right? That is good. The challenge, however, is too often people treat it as favors that they're doing for persons with disabilities, as to you exercising your basic human right. When you go shopping, my mommy does this. My mother, she goes shopping and she's a bunch and she knows she wants that kettle. She ain't taking it at the front. She's taking it one behind. If you're in a wheelchair, you are limited, as you just said, because you can't reach the one behind. So you have to wait till somebody else hands it to you. Yes, in some countries, they have a policy where you go in and you can request customer service assistance. That some supermarkets here do offer it as a part of their policy. Other supermarkets offer it as a, if there's a staff member, somebody that, like there's one particular supermarket in Bridgetown that a lot of my colleagues that work at the center that frequent because it's in their route to the bus, the terminals and such. And the staff there are so used to them that when you go in, they're really they're really overwhelmingly helpful, and that's great. But it's not a policy obligated to assist. So these are policies that we really would love to encourage persons to do, because people think that the community is taking care of us. We don't need to be burdens to other people. We don't need to, if I can live alone, if I can myself, if I can get to the supermarket, if I can pay my bill, if I can exercise all of those things, why should I have to resort to getting somebody to do it for me? If you put the proper supports in place to encourage me to be able to do that, then I can contribute back to society, as opposed to having to be forced to live as less. A lot of persons with disabilities can do for themselves. They're just not provided with the right support systems to be able to do that. They're not taught, they're not educated to be able to think like that. As soon as you start thinking like that, people think, oh, no, somebody to look after you. And like I said, that's a whole other story, and I could go on and on about it. But in general, yes, it is something that we hear about, and it is something that we're trying to encourage more and more business recognize. Persons with disabilities are consumers like anybody else. We have the same right to choose different if we want to do something different.
I totally agree. I want to get back to Elsa, though. Do you have any information about damages, any damage to houses, persons living alone with a disability, or you don't have any information?
I have not personally received any, which is good. God, I'm really happy that we haven't had too many of those. Not beyond the usual, trees down without electricity and that sort of thing. But like I said, it helped you to recognize that there are systems. In discussion with my good friend again, Special Envoy, she was the one that pointed out that with these new fiber optic modems, you're supposed to you have to pay to get that backup battery if you want additional time with your telephone service. Persons with disabilities who live in a household, even if you don't live alone, you need that extra security, because if you have a situation, persons who live with dialysis, who need regular treatments, cancer patients, persons that have chronic conditions, they have some serious issues, and you can't afford a generator and those kinds of things. So these are things that I know Special Envoy is taking very much on board, and these things.
I can tell you that the week after the storm, we had Marilyn Seeley, the corporate communications manager for, I just can't remember all of the names, but for Barbados and I believe some other islands as well. So Marilyn, forgive me. But she showed us the boxes, the backup boxes with the battery for you to be able to use. I can tell you that Flo, and she said, when I asked, can you give to some of the most vulnerable? And she said, certainly. So I believe that is in train. And persons, I'm not quite sure what categories, but I believe persons with disabilities fit under the vulnerable group. And I believe that Flo will be doing that, because they did give away some data to some individuals with cell phones, but they didn't do for the other persons who would really need that extra phone life, etc., especially people who live alone and they're lonely. So I just thought I would say that in all fairness to Flo, these are agencies, Carrie, that we want to bring on this show on a regular basis. There are people in Barbados, whether they're physically, mentally challenged or otherwise, that would need some help. And the whole idea behind this show is to bring them to the show, get people to call, and if they want to speak to them directly, or they can send us the WhatsApp messages, and we will try to make some arrangements to have that problem addressed. If we can't address it, we will certainly point them in the right direction.
Time TV, because I'm usually working at this hour. But when I was contacted and I saw the name of this show, I was like, at last, face it and fix it. Because there are so many issues in the disabled community that people recognize. I mean, I could go on and on, like inviting support for a lot of persons with disabilities to securely and privately transact their business. They are, and I understand, looking out for their own security. But just because I'm blind doesn't mean I'm stupid. You know, the other day I called an agency and the lady says to me, "Can you use a computer?" I said, "Sweetheart, I can probably use it better than to sign up for their online services." Are they going to ask Joyanne, "Can she use a computer?" Why should they
Yeah.
insult me by asking me that? That's not that's rude, you know? And then, you know, I'd have to go in and prove to them that I can. And I get why they're doing it, but there are lots of better ways of doing it. You know, disability sensitivity training, the Barbados Council for the Disabled does provide that service. Get in touch with us. We can help you to help us better. And in back to the same ELSA situation, there are a lot of agencies within government, outside of government. What we need is a coordinated approach to it. We don't need information in silos. We don't need everybody having a bit of information. No, but what if that information is locked up in the office at the Barbados Council for the Disabled? Then the National Disabilities Unit doesn't have access to that information. What if, you know, the deaf community doesn't have access to the WhatsApp numbers that they can communicate their problems to? What if, you know, there's so many. So, and that again is biggest problems throughout this whole, you know, I know we've been going on and on about the pandemic, and I swear if I say that word, you see, I'm not even saying it now because it's too much. We've said it too often. But the truth is, a lot of this came out through miscommunication and discommunication. That's not a word, but when you fail to let people know in a serious amount of time what is going on out there, when they get the wrong information, they're going to hold on to it, especially if it comes from a creditor. When all that information about France, like, I paused and I said, "Is this for real? Is this person?" I said, because I've seen things from the same individual that weren't true. So I had to go and do my own research to make sure that it is. You know, it's that, and lack of very poor communication is what results in half the troubles that we have.
So now that I know you don't want to talk too much about the pandemic, but I mean, the fact remains that the
I'll talk about it,
disabled,
just won't say.
well, you know, in terms of, we look at various vulnerabilities in the disabled community with underlying issues, health issues. Take, for example, with my daughter Sky, et cetera, Down syndrome, 60% of them were born with heart issue, and various other challenges that they may have. How is the vaccine rollout for the council? I mean, were you offered
now
it in a group so
Oh
that we can?
yes, oh yes, oh yes. I have to quickly thank Dr. Hilary Moore and her team through the Ministry of Health and their support. The Council for the Disabled had its fourth vaccine session yesterday. So that was dose number 2 for 2 sessions. So we started it back on March 8th when we had vaccine number 1, and then we had the second dose. So really they went all out to assist and support, and it was definitely encouraging. So I want to thank them publicly. And the answer to your question is yes. They also had in-home vaccines provided for those persons who could not get out to the vaccine center. So there's been they didn't avail themselves of it because they felt that they didn't have enough information. So the Ministry of Health facilitated a separate meeting face-to-face with the deaf community with their sign language interpreter. And so that assisted greatly with getting more of the deaf community vaccinated. So are there more? Yeah, but at least it was a good start.
Correct. We have a WhatsApper sending in something for you here, Carrie. They say, WhatsApp says, "Good morning. I was at the EG Polyclinic on Friday and witnessed a young man having to lift an elderly person to the dressing room because the only wheelchair there was in these clinics or if they are donated." Do you know much about the wheelchair distribution programs, Carrie? Is Carrie Ann still there?
Yes. Hello.
Yes.
Hello.
So right. Yes, I can hear you now. So the person was at.
Yeah. Well, what I'm saying is I don't know how they're distributed within the government polyclinics. What I can tell you is that with the support of the Latter-day Saints charity, Barbados Council for the Disabled has been issuing wheelchairs for the last 3 to 4 years. We are low on stock right now. We are awaiting another shipment, but we issue wheelchairs free of cost to the public. There are some charges, some minor charges in terms of admin, but it's not big. Then there is the Wheelchair Foundation. There are one of the associate members of the Barbados Council for the Disabled. They provide wheelchairs once they have in stock. And of course, there is the government agency, the National Disabilities Unit. All of these agencies are like shoes. You don't just stick your feet in any pair of shoes. If you want comfort, you have to fit them. Yeah. Now, that being said, I do think that like polyclinics and doctors' offices, and so especially polyclinics, should have more than one wheelchair available, because it is going to be.
Experience that I had with an amputee. Actually, I mentioned his name earlier in the show and offered my condolences to his family. He was a diabetic. He died on June the 19th as a double amputee. And there's a transitional community care program at the QEH, which it's not long. It's been just a couple months. And I believe he was probably one of the first recipients of that care as an amputee, because they've dealt with diabetics and cardiac patients. And so they come out and they liaise with the various agencies, and in this case it would have to be the National Disabilities Unit. The person was in a housing unit. Obviously they would have to look to see how you can make some changes to facilitate that wheelchair user. Fortunately, in my opinion, things were not expedited in the way from the various agencies, and lessons learned, because you have to look and see why things were not done in the way that they should have been. I'm not saying that led to his death, not at all, but in future, how fast can you get a wheelchair when you're amputated and the doctor at a hospital is asking for one? So as you said, to be for a while. So there are issues in some of the agencies that may have to connect with this new program, and we will bring QEH on at some point to talk about it, as well as other things. But I just want to put it there in case you may not know of this program. But it is the Transitional Community Care Program designed to assist diabetics and cardiac patients. Mr. Victor Small unfortunately died as a double amputee, but part of that program would be assist him with making all the changes in his home, because he lived in one of those terrace units with the stairs. So obviously you had to look and see, we can't get up the stairs anymore. Where are you going to put the bed? All of those things, I think, is a step in the right direction. Is this something that the council is aware of, or you're not sure about the new program that is happening at the QEH?
To be very honest, I have never heard of the program before, but I can assure you I will hear about it now, because we are going to do some research on it. The National Disabilities Unit, and let me put on my other hat, I do some work with the National Disabilities Unit, and one of the projects we run under the National, my Technology Services for the Blind and Visually Impaired, we were running a program called, funny enough, Transition, and it was to help persons who are recently coming to grips with vision loss to transition emotionally and from being fully sighted to living with vision loss. Now, we had to start, but those projects, if nothing else, it taught me especially, and others, is people think you lose a foot, life is good. You at least you got life, some people tell you. Don't worry about those small issues. It's a small issue. Those are life-altering conditions. You go from being, I was talking to a colleague the other day, she went from being fully sighted in the morning to being totally blind by evening. And these things can happen. And so the emotional health as well is very important for persons. So I'm really excited to hear about this program, and I hope that it works out for everyone.
We have another WhatsApper here, Carrie. This person here says, as soon as I can get it, okay, there it is. There's a polyclinic with washroom facilities that are not fit for persons with disabilities. There are 3 washrooms in the general clinic, and 1 female, 1 male, 1 general. These rooms do not have seat covers, safety bars. At times they don't have soap or paper. and they're not clean in a timely manner. My main concern is the safety bars and configuration of the space as it relates to the elderly and disabled built at the said clinic. And that clinic, they didn't say which polyclinic it is. But Carrie, what about the bathroom facilities in various places that people go? Are people adhering to the building codes, or do we still have these problems?
Like praise, criticism, praise. Let's start with the praise part again. Things have improved. You can find more facilities that have made the effort these days than those that haven't, right? That being said, especially those that have been around for a little while, there are necessary updates, changes, and there are agencies that can assist you. So, for example, there is the Barbados Council for the Disabled. We've been running the Fully Accessible Barbados program, where we go in and assess businesses and other places to see how accessible the facilities are. Then you have the National Disabilities Unit. They provide ramp services, social workers support. There are entities out there, and there are some private citizens who do their own work as well. So there are places that people in keeping with the code. New facilities, I like to say that a greater number of them, not all, but a greater number of them are being built with the needs of persons with disabilities at least being considered. But when it's the older buildings and so on, no, they do need a lot of work.
Okay, so given from the average person to people with a disability, because there are words that are still being used, and the R word is still being used in an insulting way for other people. You try to explain, educate why we don't use the R word anymore in describing anyone with a disability, physical or mental. In this case, it's usually directed to people in a mental state or behaving in a way that they consider is equivalent to a person who has a genuine mental challenge. I have an issue with people saying that word still, and there are people who I think that should know better. Surprisingly, there are other people who I think should know. Are we seeing more and more persons, and I don't want to use the word sympathy, because I mean, you know, I'm a mom, Sky. We don't want sympathy. We just want you to understand and respect our way of life, and to see whether or not we can level the playing field in such a way. And when I say level, I mean, for example, Carrie, let's take you. You have 20 children in a classroom, and you're giving them school books. You obviously may need yours in Braille in order for you to have the playing field level. So even though people call equity and equality, in other words, in order for you to learn, and which you have done a fantastic job at Commonwealth School, you had to have the tools in order to put you on this. Not true?
Very true. But let me give, using your scenario, let me show you how things can work out. So you've got 20 children in the classroom, one child who's totally blind. Braille is not that easily accessible in the Caribbean. I think Trinidad, possibly Jamaica, not possibly, I know Jamaica, introduction of books into Braille. But due to copyright, which is a whole discussion I won't go down now, they can't send them out to the other islands. But that's not the point. That's the only place that have running presses. We have 3 Braille embossers, which are printers. So you got your LaserJet printer, think about it that way, and you can print off things. Yes, you might be able to run off 100 copies of a letter that you need to send out, but it's not something that you can do on an ongoing basis without damaging your equipment. So our Braille embossers can't do the heavy lifting of things. But anyway, my point is, in this day of technology, there are so many opportunities to provide equality. Online learning is not possible for all persons, whether you have a disability or not. Everybody doesn't have the temperament for it. I agree. Go back to our scenario with the 20 children. If you make available electronic copies of the school material, that can provide better access. It should be done in collaboration with the teacher, in collaboration and in consideration of all the basic needs the child has, or at least if you start with electronic access, then it makes life easier. I have a little boy that I work with, and Joya, you should see the smile on his face when his teacher sends him his homework on the Google Classroom and we work through it. He lives one place, I work from home some days, and we remotely access his homework. And I'm sure one day, you ever heard about a child that submits homework 2 days early? He did
Wow.
it 2 days early because he was able to do it on his own. But in order to do that, the teacher sent it to him via the Google Classroom, so nothing fancy, nothing different. I'm not saying it was perfect, saying that there aren't challenges and things we need, but at least that little boy was able to access his work that way and get his homework in. We need to work on other methods that can include other children, the deaf, the intellectually challenged, and whoever else out there. We all have the right to an education, and we all have opportunities for access. So yes, there are ways that we can level the playing field, but there are already facilities available to us that I don't think are being utilized to their fullest possibility.
All right, Carrie, we're going to be back after this break, and we're going to wrap up with you with one or two more questions. We'll be back. Welcome back to Council for the Council for the Disabled, Barbados Council for the Disabled, rather. And Carrie, I'm going to give you the final word, but I want to close with you by saying this. When you said, yes, finally a show, and this show, like I said, it was really designed. I was sitting on at another station doing another show, and I always felt very empty walking away where people called, and all we could say was, well, I hope the powers that be hear you, and I hope that they, reach out to you. we now have an opportunity for persons when the system has failed them, because we don't want people to call us first, because we want to make sure that they still follow the policies and the rules of these entities. But it is still refreshing to know that we do have a show in this country for Barbadians and people watching in the diaspora, that if there is a problem with any of the agencies, private or government, and you fell through the cracks with the help, you can come and let us bring it to you via television, via radio, via social media, to make them aware of your problem. And I am really happy today that you are here. So that I pray to God that we can help in any way and expedite any issues that you may have, that you would want addressed, because as I've always said, when your life is challenging as it is, there's no need for other people to throw in for more mileage. You know, they just need to be fair and to need to help. But I'll leave you with the final word.
For the show, I like the initiative. Like I said, I never heard about it before, so I'm really pleased. But from persons with disabilities, the Barbados Council for the Disabled, we recently had our annual general meeting the last Saturday in June. And the theme we used for that AGM is the reality of what we want to see, journeying towards full inclusion. When Elsa blew past, she did us. And therefore, programs for mitigation, programs for remediation, programs to improve the quality of lives of Barbadians need to do just like that and include us all the way.
Thank you so much. You remember that saying, nothing about us without us. I will never forget that.
Amen. I usually say nothing without us.
Nothing. And we'll be in touch, my friend. Nice seeing you.
All right. Bye-bye.
Okay,
nice
bye-bye.
seeing you too.
Okay,
Bye-bye.
love. Bye-bye. We're on to our final guest now, Natasha Ford, Senior Fire Prevention Officer. We are going to talk about house fires and the various grass fires that we've been seeing. Well, not so much the grass fires, but the house fires, I would should say, that we've been seeing recently. And again, a reminder to Kathy, who is at home, my caregiver watching over my child, that I left 2 cell phones plugged in on Sky's bed. And I want to bring that note to the fire officer's attention, something that I should not have done and you should not do at home. Natasha Ford, thank you very much for joining us. I started off with a very bad thing that I did this morning, and calling because I don't have anybody's number stored in my head to make the phone calls, because I left 2 cell phones plugged in on a bed, and it actually bothered me so much I couldn't wait to get here to put it out there to let her know that I did that. So I want to welcome you, and we want to start on there with electrical fires. Let's start with that.
Thank you. And yes, when I heard it this morning, your introduction, and I heard that first thing first, I'm like, wow, is this really what I'm coming to? So I said, one of the things, and I think you recognized it within yourself, is that yes, we should not even plug in these phones on our bed. When you think about the electrical components within a phone, within a laptop, we're talking about electricals, you recognize that the time beyond the charging time that is associated with these devices. Now, as you can understand, if you look at the makeup of a bed, you recognize it's made of foam. You recognize you have your sheets on there, cloth, and all of these are things that burn rather easily. So you're doing yourself more harm than need, and you don't know at which point in time you can have an electrical surge. Don't forget, once again, we're still into the hurricane season, and therefore we have spikes in electricity. It's never flat, as anybody who can read a ECG will recognize these lines up and down, up and down. If you look at a person's heartbeat, very much the same thing with electricity. So if you don't have it on a safe surface, which you said earlier, a tile or something like that on the ground, on the floor, chances are that if there's a breakage in the cord, if the device becomes overheated and the conditions are right, there can be a fire.
Would the fire service then liaise with someone like the Light and Power pertaining to how often should you get your wiring checked? Because I know there's a rule, I believe, that if you have not been living in a house for over 6 months or it's not been occupied for a period of time, you must check the electrical wiring. You must have it passed before you can live in that home. Are you guys connected somehow with advising people about?
Basically, as it stands right now, yes, we do liaison with the legislating power. Once there is a new facility or there's a change in the occupancy of a facility, that information, if it comes from town and country planning, we will refer to persons and say, you need to have all of these things checked. Make sure that electricals are on par. Every person's, what, there's this thing called a 20-year span. If you've been living in a home 20 years, you should have your electricals redone. We also asked some of the electrical engineers out there what was the time frame, what's the recommended time frame, and most persons said it's 20 years. You should have your house rewired. You should have a business rewired. Now, again, as I said, if there's a change in occupancy, before it used to be, let's say, just a residential house, and you've now decided you're going to change it into daycare, you're going to change it into a bar, it means that the electrical load in that environment is going to change. And you need to have a certified electrician come in and do either rewiring or add additional outlets. Most of the time, you find that people will try to take shortcuts, and that is when they introduce this thing called the multi-strip outlet. Again, persons become confused and call it a surge protector. Now, if you know what you're looking for and what a surge protector really is, you will find that these ones that you go and you buy from most of the general stores out there, that they're not surge protectors, they're just multi-strip outlets. It's just a strip with 6 additional outlets that allow you to plug in additional appliances or anything like that. But this offers you absolutely no protection. I can tell you there are cases where we have had fires due to those devices.
So do you collect information on an annual basis, for example, the cause of a fire? Because I know sometimes you might be able to identify right away what caused the fire, and there are other times there are normally investigations. So what is the most common factor that you're seeing now for the recent spate of fires that we've been having? Have you, or maybe you have not investigated all, but let's say last year or 2018, 19, what are you seeing? What have you seen?
All right, so before I go answer that entirety, you're saying that there's been a spate of fires. No period last year, we would actually recognize that there has been a decrease in the amount of official fires that we've been having. Mm-hmm. Now, still, our view and our opinion is that if we have one house fire, that is still one too many. Yes, we do statistics, we do collect that information. Some cases, they don't have all the information because the cause has to be investigated. But I will say without fear that majority of fires are our own negligence. Fire doesn't just start like that. It is something that the onus is on us to make sure that we are safe. And most of the times, again, in your case, probably somebody's home to plug those 2 phones out for you. But sometimes persons leave the phones plugged in, leave the laptop on the bed charging, they walk away from home, leaving the stove on. What else? Some of the other causes, some of the other things that we do, we leave the iron plugged in. We have persons who, the electric kettle, this is one. We go, we buy the electric kettle, we put water in it, we don't sure something that is always properly. And once that is not evaporates, there's nothing in there, but again, the elements are still being overheated. It is made of plastic that eventually breaks down. According to what is around there, we even have a fire. Again, the electrical fans, we like to be cool. We go, we buy a fan, we don't look at the UL rating or anything on the fan. We have clothes and all sorts of components in there that once dust comes into contact with it, again, it begins to overheat. And we've had a number of fires that were caused by these same electrical fans.
I heard a lot about the electrical fans that people buy. People will say that they got the fan, they could smell something burning in the fan. Some people have actually claimed that they just bought the fan. It's not like 2 months old. So how do we know? I mean, we clean the fan, but you could be sleeping and the fan catches. No fault of yours. It could be a fault in it. Because there are new fans that give trouble.
Like anything else, things that are man-made, they're man-made. So it is not always this that I can say to you, you know what, as soon as you go and buy this assembly line that just, they have a fault. And that is not, they're not always able to capture it at that point in time. Yes, you end up buying a device or a fan in this case that has some electrical problem. But you said you're asleep and this fan catches a fire or you smell something. And one of the things the team, especially for this year for fire prevention week, which is in October, is to learn the sounds of fire safety. And when we talk about the sounds of fire safety, we're talking about the smoke alarm. And this is a small device, first alert device, that if anything happens, even if you are asleep, if it detects smoke, it gives the loud audible alert that tended to wake you as the person within that room sleeping. So there are things that you can do to protect yourself. It is not all gloom and doom. We've also added some avenues. There are things that you can buy, devices you can buy, equipment that you can buy to safeguard your home and to safeguard yourself.
Okay. What about ceiling fans? I normally keep my ceiling fan on a little too long, all night, all day, all night, all day. I mean, we know about the
So remember,
standard
I said
fans.
again, because mhm.
I know about the
I don't
standard fans,
recall
but go
we
ahead.
having any statistics of any fires pertaining to the ceiling. But remember, I said earlier, most fires are due to our own negligence and our own carelessness. What would be the reason for having on the ceiling fan just going constantly? Again, these things are electrical. Now, if it is, yes, as you say, the ceiling, there is a ceiling. How often you go up inside that ceiling, or does somebody go up in that ceiling to check to that all the wiring up in there is still intact? Is the wiring run through a conduit? Is it a case that you're sure there are no rodents up in there? I'm talking in terms now of bats, rats, that there are no rodents up inside there gnawing at these wires or anything like that. You see, once something seems to be out of sight for us, we don't think about it. Most of the times we just look at what's before our very face and forget everything else. Once the house looks a certain way, that's it for us. But at the end of the day, we need to go back to being babies in some cases, where we get on our all fours and we just do a search around our home. Look at all the electrical outlets. When you plug something in there, does it smell funny? If that is the case, stop using that outlet. Get an electrician to come in to check. Maybe there's some sort of wiring going on there. When last have you gone into the manhole of your ceiling to check up inside there to make sure that everything's okay?
I can tell you that my mom for sure, minus the fridge, she, she plugs out everything. Even if the lamp was plugged in, if it's off, charger, she plugs out every last thing at home and just leaves the fridge for obvious reasons. But I want you to share with us, and in particular me, because we need a little refresher. So you got a fire started, say, with oil, electrical fires, various chemicals that can trigger off fires, but there are some types of fires that water would even make it worse. Can you slowly, even though we got like less than 15 minutes, about 10 minutes, go through the fires, the types, and what types of products would be recommended to use to out these particular fires? Because I know water is not for everything.
Sure, that is. No, it is not. So basically, our fires have been broken down into different classes. We have class A, B, C, D, and class K. Class A fires, basically those ordinary combustibles, things that you find readily around the home: paper, leaves, clothing, that kind of stuff. And this is the one that, yes, you can feel free to use your water extinguisher or your water on. And again, because water is our most readily available source, that is what most people will tend to go for. Again, it's only with that class that we would advise you can use water. Again, it is paper, and those things that if you're going to be talking about our class B fires, this is our flammable liquids and gases. So the flammable, these kind of things, I'm talking alcohol, well, some alcohols. And we would use something called foam on these fires. And if with the alcohol, what I said, sometimes alcohol is because there is a special formula that you need for alcohol. And this is the spirits that we're talking about. This is some extinguisher called resistant foam that we use on those type of fires. And we have our clay fire, which is a special kind of fire. It is our energized electrical. Now the difference here is that once you can de-energize the equipment that you're speaking about, whether it be the toaster, the kettle, whatever, it normally goes back into a class A fire. Then you can put water on it. If it's one of those things that carry like a lithium battery that still holds the charge, you need to be careful. As I said, the microwave oven goes back to ordinary combustible, which is a class A, which you would use your water extinguisher on. Your class C fire, however, the extinguisher that you would use on this is one called a CO2 or a carbon dioxide extinguisher, which is a pressurized gas. It is very, very cool. So you have to be extremely careful when you're using this extinguisher because if you hold the wrong part, you can actually get frostbite. Then we have our class D fires, which are our combustible metals. And most of the times when people ask what combustible metals, these are the ones that are reactive when it comes to water. Because water contains oxygen, you will find that it tends to flare up and everything. It will make it worse. So for our combustible metals, and some of these metals are things like aluminum, magnesium, chromium, we have zinc. First, we use an extinguisher called dry powder. And if you had the opportunity to visit the airport fire station, you would see that that is the media that these guys up there use. Again, because water is reactive, they cannot afford to put that on there. And then we go to our class K fire, which is our commercial kitchen fires. And the reason for putting this, now you won't call me at home and tell me you have a K fire. You don't have the amount of oil that these places use. They have the deep fat fryers, the commercial stove tops and everything that they're using copious amounts of hot oil. Now we had to find a special extinguisher for this class because the temperature at which these oils burn is extremely, extremely hot. And of course, we had to then find a class of extinguisher that could create that barrier that would keep the heat in and not allow this fire to continue to grow. And for that, we bought one called wet chemical extinguisher.
Mm-hmm.
So again, we go back.
So I mean, it must be a website because I know you guys are doing a lot of communicating with the public on different shows. There's a show I think you have 311. Sorry,
311.
Yeah,
Yes.
and I think is a fantastic idea because we continue to educate, go to the schools because in our minds, I'm telling you, you see a fire, the first thing you're looking for, you don't know how it happened, you're not sure what it caused by, is a bucket of water, a cup, or a wet, So, but is it helpful that if you are going into a burning home, because people do that until the fire service get there to try to save people without thinking.
Mm-hmm.
I've seen this on TV, so I don't know if it would be real life, that you can wet a blanket of some kind to try to put a wet cloth, a big blanket around you to get into the house. If, I'm not saying that we're encouraging people to run in, but if you're going to do it, protect yourself and help.
Definitely. And definitely. No, we know that persons are very eager to help once the need arises. That persons tend to disregard their own safety and they will try to help. That's called being your brother's keeper. And I can understand that. No, again, as you said on television, we see these things happening. And remember, these persons are being paid lots and lots of money to act. It is an act. It is Hollywood. They create the environment. So which means at the end of the day, it is a safe environment. However, on our end now, we don't have that flexibility, and we ask that persons, yes, if it is the case that you can maneuver safely, the fire is not big enough, and you want to help, then go ahead. But once you recognize that it has grown beyond the point that you can proceed safely, then stop and let the persons who have been trained, which would be the fire officers, to do their stuff. You would recognize when they come in, they are fully geared up, they have everything on them, BMS, everything, so that allows them to breathe within the environment. So for those persons out there, if you want to assist us, once you've done your part before we get there, it means help us locate where the hydrant is, where the officers come, where the hydrant is. Help us to pull hose, but please So pull the hose
It
over
would
and
also
allow them.
it would also be helpful to you to know where the water outages are in the islands before you go, so that you don't open up a dry hydrant.
And
Uh, and you do
it is
need to work with the Barbados Water Authority and make sure that is done, that you get information every day.
and you would know that.
It was happening back then. I don't know if it's happening now, but truthfully and in a sincere way, a genuine reminder, Water Authority, to please make sure you share the information of the bursts in this country and the outages, so that when the fire service will go and they will know we're going into an area that has no water, so you would know how to then position yourself with the additional water and from where and how. Because those couple seconds will be the difference between
Tanker.
saving someone's home or life. Natasha, we're running out of time, but let me tell you, I would like to see the fire service on this show at least once a month. Because I still want to make sure, well, we'll send you some messages because people want to know where you can get the fire extinguishers from, and we'll share that information on the show. And, because we want to make sure we have people equipped with the right things in the event that there's a fire, so that we can minimize and help the fire service, so they don't have to be up and down, because you've got other things other than fires, which we can talk about another time, would be when we see you responding to an accident. And then you have to use the jaws of life in order to save individuals. But you're doing a fantastic job. Much respect due to the fire service as always. I want to thank you so much for taking some time to talk to us. Thank you. We'll be back.
Thank you very
too.
much.
Okay, we'll be back after the break.